Now, let's take a listen to our next guest. Welcome to the Bay Area Focus, our weekly public affairs program from iHeart Radio San Francisco, highlighting issues and organizations working to improve our communities. I'm your host, Tinka, and I'll let the guests introduce themselves today, the organization that they are with. Guest, welcome.
Yes, my name is Ben Louis. I am an internal medicine primary care physician and public health professional, and I am currently serving as the Chief Medical Officer at On Lok.
Can you tell me what is On Lok?
Yeah, On Lok, we are an organization devoted to serving seniors to help them live the life they want, and we are known for the PACE model. We are the founder of a model known as Program for All-Inclusive Care for the Elderly, which is PACE. We have been in existence in 1971 as the founder of this model.
Who does your program serve?
Yeah, we serve a range of seniors. Our PACE model, what we are known for, serve seniors who are age 55 and older, who typically have a complex health profile. They are typically nursing home eligible, and our program is a all-inclusive nature of this program allow us to help them remain in their homes. So even though they are nursing home eligible, the vast majority of the seniors that we serve are able to remain in their homes. In fact, 95% of them are able to do so.
When you say the elderly that we serve, what is it that you actually do for them?
So we are a healthcare delivery system combining primary care and long-term care to enable the seniors to live the life they want. So what our model is known for is really comprehensive person-centered care to support these individuals who are, again, typically have complex, cognitive, functional, and medical needs. And we are able to help them remain in their homes in the communities. We perform a lot of care coordination. And the interdisciplinary team is comprised of a wide variety of healthcare professionals like primary care providers, nurses, social workers, rehab therapists, activity therapists, dietitians, home care nurses, caregivers, and drivers. As you can see, it's a wide variety of healthcare professionals, and we put them together in an IDT or interdisciplinary team, and we coordinate their healthcare and their services, and we focus on prevention, health, and wellness, and really the continuity and the care coordination is what makes this model works to care for our seniors.
You're listening to the Bay Area Focus, our weekly public affairs programming from iHeart Radio San Francisco. I'm your host, Tinka, and we are talking to, can I say Dr. Ben?
Yes, you may. Or you can, call me Ben, whatever you like.
Dr. Ben today from On Lok. Is that we call it On Lok?
Correct.
Where seniors embrace life. The National PACE Month has a theme, Dr. Ben. It says, simplify your life. Can you talk about that a little bit?
Yeah. So the theme of simplify your life, I really think of when many families and seniors, when they have a relationship with On Lok PACE, with the PACE model, oftentimes what I find that the families almost, breathe a sigh of relief, because with the complexities of a lot of the seniors that we care for, the family receive a great deal of support. And the support is by the entire team that, as I mentioned, an entire team of dietitians and social workers, home care workers, nurses. I can, name many disciplines in our team. They are able to provide the family the support that they need. And many families, they work, they have lots going on in their lives, and it's just not easy, as we know, to care for our seniors in a very fragmented healthcare systems as well. They often have to try to coordinate care on their own and make appointments, arrange for transportation, find ways to support the daily needs of the seniors. And so what our model allows them to do is to really get the help and get that we can do the care coordination for them. We can essentially really, when they come to us, it's almost a one-stop shop. It's a one-stop shop where we can coordinate and help them avoid having this really fragmented system of care. And so, again, I think the sigh of relief comes from the fact that now they have a whole team of healthcare professionals who can help them care for their dear seniors.
And so what is your favorite aspect of working at On Lok?
I think my favorite aspect is really working with our compassionate team members and dedicated team members. And I think that this is it's a joy to work in a system where our staff really believe in the work that they do, and they, go above and beyond every single day, and to really deliver the care the right way. And a lot of what we do, addressing the social needs of our seniors and, their day-to-day needs. In a non-PACE system, there are often times when the patients may only see the healthcare providers once every 3 months, but we have many more touch points. We are able, through all our different care team members, our home caregivers, our drivers, and when they come to the day health center, they interact with, the different disciplines. They do their functional maintenance program with our physical therapists. So all these touch points allow us to build those relationships with our patients. I think the relationships and the dedication and the passion of our staff, that's the favorite aspect of my working at On Lok, helping to support our teams.
You're listening to Bay Area Focus, our weekly public affairs programming from iHeart Radio San Francisco. I'm your host, Tinka, and we are talking with Dr. Ben today from On Lok, a place where seniors embrace life. Dr. Ben, a person, make it as plain as possible, a person who is dealing with their senior parent or just a senior period, they should call you On Lok if what? If what is going on with that senior's life, they should call you.
Yeah, I think that, when you find it overwhelming to take care of somebody in your family, a senior, you find it overwhelming. You find that you're having difficulty coordinating various aspects of the care. If a senior can benefit from help with transportation, with home care, who can benefit from having more socialization. Again, when you find that you can use help in caring for the senior, I think you should consider giving us a call. I think that many seniors have medical complexity. They may have cognitive or functional decline, and there are many reasons that they can benefit from this PACE model, which again combines long-term care and primary care, which is unique. Most health systems focus more on the medical care side. We know that for healthy senior is beyond just the medical care, is beyond just the medications and the treatment of the chronic diseases for many of the seniors. Is really the day-to-day lives and the support that they need to thrive. And so the PACE model, the uniqueness is that it combines the long-term care to support their day-to-day needs in addition to their medical needs, in addition to the primary care. So those are some of the special aspects of this model, really addressing the comprehensive needs of the seniors.
Now, how is this service paid for?
This PACE model is funded by Medicare and Medicaid. Typically, say the vast majority of our participants are on one or both of the public insurance programs. There are exceptions, and again, I think I would urge that for families who are looking at assistance with caring for their seniors, give us a call. Go to onlok.org and contact us, and we can reach out to you and to have a conversation to figure out if this program is right for you.
So mental health now, Dr. Ben, is real heavy from you, for seniors. The seniors being lonely has become a big topic as well. So do you guys deal with that too on the mental health side, as well as socialization on the loneliness side? You guys deal with that too?
Yeah, absolutely. That is really an integral part of that all-inclusive care model. We have at On Lok, we have behavioral health clinicians who are typically counselors, some of whom are licensed clinical social workers, some of whom are licensed family therapists. And our counselors are embedded in our interdisciplinary teams. In addition, we have social workers as well. And of course, the entire team help to care for the mental health needs of our participants. Again, that is really kind of integral to their whole person health. And so this is absolutely a integral part of our model. And so when there are mental health needs, the interdisciplinary team, the IDT, would assess what those needs are and also how it may impact their care plan. So each participant has an individualized care plan which take into account the holistic needs of the participants. And yes, during during COVID, during the pandemic, we were able to have many touch points to really address the loneliness of the participants. We're able to do wellness calls. We're able to, our drivers continue to connect with them, to deliver meals at times when they need the nutrition support. We're able to continue to deliver the medications. And some of our participants really, they let us know, they share with us that for many of them who are quite isolated, who may live alone, we were the lifeline, not just in terms of getting the meals that they need, but also getting the interactions and support from our staff. So our model allows us to have many ways to address the mental health needs of our participants.
So once again, can you tell us, how does someone contact On Lok PACE if they are interested in enrolling?
If they're interested, they can call 1-877-219-5558, or they can contact us at onlok.org, which is onlok.org.
You're listening to the Bay Area Focus, our weekly public affairs programming from iHeart Radio San Francisco. I'm your host, Tinka, and we're talking with Dr. Ben today from On Lok. Dr. Ben, any last words?
I think my last words is that I think that a senior's health is more than just the medical aspect, and is really they're addressing their day-to-day needs, addressing their social needs are very important part of promoting the health. So I think that again, it takes a village to care for our seniors, and the PACE model is able to provide that support and that team to help coordinate the care of the senior, to ensure care continuity. They're able to follow them, through different levels of care. And so I think that if you are feeling overwhelmed with caring for a loved one who's 55 and older, and consider looking at the PACE model, consider looking at On Lok PACE, and give us a call to see if we can help you, and he'll provide you that support and that village that is really needed, to effectively care for a senior.
Thank you for your time. This has been very informative, very, very informative. Thank you so much, Dr. Ben. And if you need it, it's here for you. Reach out. Thank you for joining us for Bay Area Focus, our weekly public affairs program from iHeart Radio San Francisco. Today's guest was Dr. Ben with On Lok. If you have an organization or something you feel helps to better our community, then please contact me at tinka@iheartmedia.com. I'll be back next Sunday with another edition of Bay Area Focus.